So my name is Julie Wardrop, and I'm one of the voices, the Cancer Voices panel for the ICJ project in Dundee. I'm 46, I live in Dundee, and I was diagnosed over 10 years ago now, but I was diagnosed with ovarian cancer. I was in my early 30s when I was diagnosed, and it came as a huge shock, and for me and my family, and found it really very difficult. And the hardest part for me was my treatment. The chemo and the surgery were really, really difficult. But I felt really lucky because I had good support from a MacMillan nurse who was very caring, who was able to listen and be with me through that journey and to provide support to me and my family. And so I had a very positive, although very difficult, I had a very positive experience of cancer. And actually, the experience that I had led me to make changes in my life that are still profound for me now. And I wouldn't be sitting here doing this if it hadn't been probably for that nurse. Unfortunately, a couple of years ago, my father was diagnosed with lung cancer. And sadly, what I experienced for him it wasn't the same experience. He didn't have that support. There wasn't support for him or my mum. There wasn't good clinical support, but there also wasn't good care. There wasn't anyone to listen to his needs. I think that's what I'd like to say. There really wasn't anyone to listen to what his needs were and what the family's needs were. And he was really isolated. And this was the last 6 months of his life when all of us could have used support, him, but the rest of us as well, and we couldn't find it, and it wasn't offered. And once my father had passed away, very sadly, I was really motivated I had seen what was really positive and possible in cancer care, and how difficult it could become if that was missing, that kind of person-centred approach. Okay, sometimes when you have a cancer diagnosis, it's very hard to sort of think your way through it. And you don't know what you need if you don't know what's available, but you know you need something. And just having someone to sit down, listen to you, listen to your story, share what the possibilities are for support, can be really, really profound. And it's really meaningful to have a compassionate conversation with somebody who is experiencing cancer, but also if you have the knowledge and the skills to be able to put in place a structure of support for that person, it can have, you know, ongoing effects and ripples for that family for years to come. I know that the support that I was offered changed my life, not just because of cancer. I discovered things that helped me with my mental health and all sorts of things, and carried on way after my cancer journey. So I know how profound that kind of support can be for somebody.
Hello, my name's Brian Weir. I'm 60 years of age and I live in Dundee, and I was diagnosed with throat cancer in 2013. My diagnosis arose when I went to the doctor about another matter. I can't even remember what that was. I'm not just saying that because it was something really embarrassing. I can't remember. But at the time, I'd had an ear infection a few months before, and I had a lump in my throat, and I thought I had a swollen gland from my ear infection. Told my doctor that, and he explained that they had a low tolerance level for lumps of that kind, and immediately referred me to 9 Wells. I went there the following week, and after a series of tests, some painful and some not so, I was then diagnosed with a cancerous tumour at the base of my tongue. I had a consultant in ear, nose and throat who referred me then to an oncologist. And my oncologist told me that I was going to be in for 2 years of hell, but he was confident he'd be able to sort my cancer out. I had a great support team, the clinical support team, that talked me through the procedures, guided me along the way, and with their aid, I got through the radiotherapy and chemotherapy. But when you're first told you have cancer, it's absolutely devastating, because cancer, the very word, has such a devastating impact on everyone because of the associations we make with it. It was also at that time that I realised the implications for my wife, and how, when I was diagnosed with cancer, she pretty much got that diagnosis as well. Because although I had the physical effects of the cancer, she suffered a lot of the emotional trauma that cancer brings with it. I was a police officer for 30 years, and in that time I became skilled in very few things, but amongst the things I did become skilled in was listening to people and talking to people. And I found that I wanted to do something about my cancer experience because it was a very difficult journey for me. But what I wanted to do was try and help people who were going to go through that same process and possibly make it a bit easier for them by explaining some of the things that were going to happen and not round the edges, but tell it as it was. So that I can use my experiences and my skills to ensure that people in Dundee receive a consistent approach to their cancer treatment. So having spoken to a number of people who have had cancer in Dundee, I know that levels of care varied quite dramatically. And it's my opinion that I've worked with a lot of agencies in Dundee, and I know they have the enthusiasm, I know they have the skills, but it's bringing that to bear to make sure that anyone in Dundee who has cancer receives a consistent level of approach, but not just consistent, but a high standard of care. And I think the Improving Cancer Journey can do that, and I'm more than delighted to help with that process.
Hello, my name is Ravina Zafar. I'm 51 years old and I live in Dundee. When I was diagnosed in NHS in Nine Mills Hospital, I had really good experience. They started my treatment there and then, and I was well looked after. But unfortunately, I wasn't informed about the medical aspect and about the support services which are available for cancer patients and for the family. I believe when a person is diagnosed, if somebody can signpost them and somebody can guide them that these kind of support services are available, that can create a huge difference. Everybody who has this diagnosis, they should know that support is available. They shouldn't be suffering alone, because when you are able to talk to an empathic listener without being judged, it's therapeutic. It makes your journey quite a bit easy, and you feel that you're not alone. You can share your insecurities, your worries, because it gives me an opportunity to share my experience and to create this awareness, especially in BME community, that they should not feel ashamed of their diagnosis and they should not suffer alone. There is support available, and it's everybody's right to avail and feel comfortable, in control, informed, and more involved throughout their journey, cancer journey.
Hi, I'm Karen Boland. I'm 38 and I live in Dundee. When you hear the word cancer, my first thought was, oh my God, I'm going to die. Which then the next thought I had was, oh, I'm not going to have a baby. Which I think as a young woman is really difficult to deal with. So that was my major thought was, I suppose I was mourning the fact that I may not have the chance to have children. Because of the issues that arose following my aftercare, being sent home without any sort of guidance from the physio, being sent home, there wasn't really any care plan, any follow-up. I was told other than to come back to the ward to get the catheter removed. Other than that, I wasn't really given any other guidance. I was told to watch for infection in the wound, but I wasn't actually told what that would look like. And I think that was one of the scary things, I would say. It would be nice to have some guidance on that. And I think because of the aftercare, I think that could have been improved greatly. And I think that's why I'm so passionate about getting involved with the Improving Cancer Journey. I want to help other people, and if through sharing my cancer experience, if I can do that, then that would be great. And I think also I really want to highlight the point that women need to keep up to date with their smears. I wouldn't be sitting here if I hadn't had my smear. And I think for some discomfort for a few minutes, it's worth it. It can save your life.